In regards to embryo quality, it is a little bit more tricky because when we are talking about embryo quality, we also need to take into consideration not only the egg but also the sperm. So, for the purpose of this podcast, what I'm going to say it is again, we're going to talk about internal quality, that we can separate the internal quality into the genetic quality and the energy quality of the embryo. And also we can talk about the external quality. So about the external quality mainly means what we can see about the embryo. And I'm talking about the morphological quality. To grade this, we can grade the expansion, we can grade the number of cells that are in the trough ectoderm, and we can also assess, check, and the inner cell mass. So all this is going to give us the external quality. But probably the most important will be the internal quality. And when I'm saying this, I'm talking again about the genetic, and I'm talking again about the energy of the embryo. Genetic mainly is influenced by age again. And I'm talking here about all these important situations where the patients are over 40, and of course the internal quality of the embryo is going to be potentially can be compromised. So for the internal quality, we can check this with genetic investigations such as PGS, which is a pre-implantation genetic screening, and mainly we can see if all the chromosomes are there. But of course, we still don't have an investigation for checking the energy of the embryo. About the external factors that can influence the quality of the embryo, the two most important will be, of course, the culture media and the laboratory of IVF, and of course the incubator that we are using for the IVF cycle. And for that reason, it is mandatory to go to a clinic that they have all the accreditations and the standards. In terms also about the internal quality, I need to say that the investigation that we are using for this will be the PGS or the PGD. And of course, with this one, we can assess all the chromosomes in the embryo. So in that way, we can ensure that the embryo that we're going to transfer is completely normal, of course. As I was saying before, when we are talking about the embryo quality, it is a little bit more tricky because we also need to take into consideration the sperm quality. So the sperm quality is something that we really need to assess in advance before going to the treatment. So in order to do this, what we need to do is to check the DNA fragmentation and of course to check the FISH test. If both are completely wrong or the outcome is poor, so then the recommendation will be again to proceed to the treatment, doing a genetic testing into the embryo.